Hello, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about tick-borne illness and pregnancy. So there is a lot of controversy over this issue. And some people believe that it is transmitted through the placenta, and some people do not. The fact of the matter is, it is absolutely transmitted, and so is Bartonella, and probably so is Babesia and all the other infections, just like strep, cytomegalovirus, rubella, just like every other infection. So you do have to be careful with tick bites when you want to try and get pregnant. What I tell people if they have tick-borne illness and they want to get pregnant, they need to go on a couple of antibiotics, depending on what organisms they have, that protects the developing fetus. And probably the two best are Zithromax and Amoxicillin. Zithromax will protect you from Bartonella. Amoxicillin will protect you from Lyme. And the first trimester, you can't really do anything to protect Babesia. In the second trimester, you can introduce Malarone. But in the first trimester, it's a little bit dicey, and you really don't want to do that. So I tell my patients to only take a prenatal vitamin, which hopefully has enough D. You do need to be taking D for sure, and probiotics, and then antibiotics. And sometimes we have to use Nystatin as an antifungal, because I don't want people who are on antibiotics to develop a yeast infection. So we do recommend that people go on Nystatin, and you should start taking antibiotics, Zithromax and Amoxicillin, I would say a month or two before you want to get pregnant, and just set the stage for success. Because if you bear a child that has tick-borne illness, you can't reverse it. You cannot go back. And children born with tick-borne illness often have lots and lots of difficulties. I mean, we see autism, we see premature birth, we see all kinds of heart defects. It's not insignificant. And so, to really set the stage for success, you should really go on antibiotics about 2 months before you want to get pregnant. And then all through pregnancy. And then at the time of delivery, you want an Igenex kit that tests for cord blood for Lyme disease. And the cord blood can be tested in 3 different places. So one end, in the middle, and then the other end. And those can be sent to Igenex, and they will run a PCR test. And a PCR test actually documents the DNA of the organism. And so it's a very useful way of finding out whether or not Lyme has been transmitted to the placenta, through the placenta. So once the baby is born, depending on if you want to breastfeed it or not, if you're going to breastfeed, you need to stay on antibiotics, because absolutely tick-borne illness is transmitted in breast milk, and it's actually very strong. So you stay on Zithromax and Amoxicillin all the while you're nursing, and then when you stop nursing, then you can go back to your original antibiotics. Now, I will tell you, a lot of people say that they feel much, much better when they're pregnant and they have tick-borne disease. This is common. The increase in progesterone and estrogen very much changed the internal milieu of the body, and I think it basically acts as a infection suppressant, because most people feel better when they're pregnant, and then when they give birth, they oftentimes will feel quite a bit worse. So I hope this information has helped you, and I hope you have a wonderful day.